So one of the reasons this training came up in the way that we're going to go through this training is I get a lot that we learn in school and about the theory of CBT, right? We understand that it involves thoughts, behaviors, actions, but what does that really mean for application? So what do we actually do with our clients that's related to CBT, and what helps them move through whatever issue they're bringing to you? So I'm going to switch things around with the presentation because it was shortened a little bit. So we're going to do my favorite CBT activity of all time. Some of you have done it already, so you guys are going to be kind of leaders at your table to help facilitate some of the challenging parts of it. And then if we have time, I'll go back to some other stuff that's relevant as well. So we're just going to kind of swap it today. So the metaphor for today's CBT training is an iceberg. And the reason it's an iceberg is because we get the thoughts, feelings, and actions are kind of at the top, and then there's all this other stuff that we can do that changes those thoughts. I need to put this down before I start waving it around. So underneath the iceberg are all the ways that we can apply our knowledge of the fact that thoughts affect feelings, affect behaviors, and vice versa. So as just a pre-exam, how many of you are familiar with the CBT triangle? Everybody knows what that is? Is there anybody that's never seen the CBT triangle before? Okay. So I'll review it quickly. Ants, does everybody know what ants are? Automatic negative thought, right? Okay. Core beliefs, does everybody know what a core belief is? What statement usually gets to the core belief? I am. Good. I am. You guys are doing really good. And then the last part will be problem solving. So those are kind of the four key components to what CBT really entails. Go ahead and click for me. Yeah. There's you saw the iceberg though, right? That's cool. Okay. Just the arrows.
Here's an arrow. Oh, these arrows.
Yeah, those arrows.
Okay.
So then press that arrow. Yeah. Okay, so this is a picture of the triangle. And just as a review, we have thoughts, emotions, behavior. It's a triangle because they all affect each other, right? So sometimes my actions affect the other two. Sometimes my thoughts affect the other two. But the key to the triangle is that if I want to change one, I have to change the other two. So that's the triangle in a nutshell. Ants, we'll come back to this later if we've got time. That's the automatic negative thoughts. Go ahead and arrow through for me. Core beliefs. So one of the challenges that we're going to get to when we get to the my favorite worksheet of all time is that typically when we get automatic negative thoughts, we get things like everything always goes wrong for me, right? And then what was your example? The automatic negative thought? We're going to get sued, right? So what we're going to do today is take that a step further. So what does that say about me as a person? Okay, so when we come up with the automatic negative thought, we want the I am statements. So sometimes I'll have to ask my clients that a couple times to really get at what's underneath all of those other thoughts that are going on. So if everything or nothing ever works out for me, what does that say about me as a person? Am I a failure at life? Am I unlovable? Am I unworthy? So what is the core belief underneath those other automatic negative thoughts? So this is just a worksheet. Usually what tends to happen is it's like a magnet. So every experience in which we have the same core belief, they all attach to each other. So that's why a lot of times we get certain situations that don't seem like they're related, but really they are because they all share that core belief. So we'll go into that in a little bit more detail if we want to later. And then the last piece is the problem solving. So that's really kind of the four components to our CBT stuff. And then click one more time for me. So how many of you are familiar or do the basic thought log? So how many of you have had your clients come up with what's the situation, what's the feeling, thought, and behavior? Have you guys all done that with your clients? Okay. So we're going to do the thought log on crack today. We're doing like the extreme thought log today. So we're going to take that a little step further. So one more arrow. One more. So we're getting deeper into the iceberg. That's the metaphor. All right, so I can't play the video today, but it was just a kind of a diving in point. We don't really need it. It was an Austin Powers group therapy clip. I couldn't find a What About Bob one that fit. So I want you all to pull out the main worksheet that's on the table. And there are two sides. So I want you to flip it to the side that says Thought Record 2. So I'm gonna walk you through it piece by piece this time, and then we'll get together in your small groups to role play with each other. So the first three boxes are your normal thought log, right? So you're coming up with a distressful situation. So for my Austin Powers clip, the situation was that Scott had just met Dr. Evil, his dad, for the first time because his dad had been frozen for many years, and Dr. Evil wants Scott to take over the world, right? Evil domination. Does anybody remember this clip? Yeah? Okay. So the situation that's causing Scott distress is that Dad wants me to take over the world and he wants me to be evil. So what are the feelings, just shout out feeling words, that might go with that sort of situation? Pressure, so feeling pressure. Frustration. Nervous. Scared. Conflicted. Yeah, okay. Now it says 0 to 100. I usually use 0 to 10 scale because I work with kiddos. But I want you to rate for yourself internally on a scale of 0 to 10, 10 being the most intense that feeling has ever been for you, 0 being no intensity at all. How scared would you be if your dad wanted you to take over the world? How nervous would you be? Right? How conflicted? Okay, so what was the hot feeling? So the hot is the one that was the most intense. Were there any 10s? What was the 10? The hot feeling.
Or how I felt about the situation?
It's the hot feeling is the feeling that you've already labeled that's the most intense. So out of all of the feelings that we all shouted out, which one do you think is the most intense for that situation? Terrified, yeah, that would be a 10. So you have your client go through and you rate each feeling on a scale of 0 to 10. Then you have them come up with the automatic thought. So this is where I'm going to challenge you guys a little bit, where we typically come up with all of the negative thoughts, right? And our client usually doesn't have any problem coming up with negative thoughts that go along with the situation, but usually they're not I am statements. Sometimes they are, right? Sometimes we get like therapy gold and it's like, okay, I know exactly what this core belief is and we're working on it. Sometimes you have to dig a little bit. So in this scenario, what do you think Scott's core belief is that his dad thinks he's going to take over the world? He doesn't want to. In the clip he says, I'm afraid that my dad's that he wants to kill me and that he hates me. Right, and then Dr. Evil says, well, he's astute. I have been trying to kill him. So what do you think his core belief is? What's his I am statement?
I'm not loved by my father.
Mm-hmm.
I'm not a good son if I don't do it.
Yep, I'm not a good son. Mm-hmm. I'm not good enough. Great. So you can see where the superficial thoughts, right? My dad wants to kill me. My dad wants me to take over the world. These are negative thoughts, but they're not the I am statements. So what we really want here is the I am statement. The question that can get you there if you're having trouble or if your client really doesn't know or isn't aware is, what does that say about you as a person? So the fact that your dad wants to kill you, what does that say about you as a person, right? I'm not worthy of love, or I'm unloved, okay? So then you're going to do the same thing when we go through this. Your goal is to have an automatic thought that goes with each feeling. So what's the I am statement that goes with terrified? What's the I am statement that goes with confused? What's the I am statement that goes with conflicted? So it may not always match up, but that's what we want to try to see. And then you're going to do the same thing. You're going to rate what's the hot thought. So out of all those, what is the most intense thought? And usually when I frame it to my clients, I'll say, what's the one that replays over and over again, right? What's the broken record thought? And try to identify what that one is. And then usually I'll circle that one, and that's the one we're going to work on. So for this example, you may all pick out a different one for Scott and Dr. Evil. So go ahead and identify what you think Scott's automatic negative thought is. And then circle the one that you think would be the hot thought. So I'm unloved, I'm a bad son, I'm a failure, Okay, thumbs up if we've got the automatic thought. We're good? A couple more seconds. Okay. Now, what do you think Scott's initial reaction is going to be? So in the clip, he starts yelling at his dad, and he says, "You always do this to me," right? So that's kind of what they show in the video. What do you think Scott's initial response would be if he's feeling terrified, conflicted? His dad wants him to take over the world and be evil. He talks about how he wants to be a veterinarian and how he wants to open a petting zoo. And Dad's response is, "An evil petting zoo? An evil vet?" So what do you think Scott's first reaction would be?
I think first it might be anger,
But anger is the feeling.
the reaction. Oh, thought, sorry.
So what's the initial behavior response? So what does he do when he's feeling that way? He's feeling angry, terrified, conflicted, confused. He's thinking, "Dad wants me to take over the world." He yells. So the first thing he does is he yells. What might he do when he goes home? What's a way he might cope with the situation when he gets home? Does drugs. I'm smoking a lot of pot, so I don't have to take over the world. What drug do you think he'd be using, right? Probably some pot to subdue to depress that. Yeah. What other behavior responses might you get?
I'd shut down.
Shut down. So maybe some self-harm stuff, right? Does he go home and he's like, "I'm a terrible person," and he's doing some cutting or some suicide ideation? Anything else he might do? He might cry.
Run away.
Run away? He might run away. Yeah. If Dad can't find me, then I don't have to take over the world. Any other behavior responses that you might see?
Going to Dad's workshop or office.
I could totally see that, right? Like just taking a machine gun and just shooting up the evil lab. Yeah. Run away. Any other behavior responses you might see from that? So then when you have your client come up with all of those behaviors, and this part's really important, you want to rate what the effectiveness is. How does that work for you, right? How effective is that at decreasing your anxiety, your feeling of terror, your confusion? And usually, I think out of all the times I've done this, once or twice I've gotten a 0%, right? Because if it's 0%, they're probably not going to do it again. But if they're getting a little bit of help out of it, if it's decreasing some of those emotions, even if it's a maladaptive coping skill like running away or using drugs, it's still helping them. That's why they're continuing to do it. So this is our first chance at validating that they are using coping skills and that it's working to decrease those negative feelings, the unpleasant feelings. So go ahead and rate. If you were Scott, how much would that help decrease some of those feelings for you? If you ran away, if you destroyed the evil lab. And so usually I'll encourage them to give me a percentage, right? So is it 50% effective? Is it 10%? And also, for as many times as I've done this, I've never gotten 100%, right? So usually nothing is going to make that feeling go away totally, right? So we're looking at in between, probably like around a 10% to 90%. Everybody good? Everybody's rated your effectiveness? Okay. So then the next part, and this is what takes the thought log to a different place. This is where we really get to some depth with this. So and this is our second chance at validating that what they're doing doesn't make them crazy. Right? So this is one of the reasons it's one of my favorite CBT activities, is because a lot of the times when we do regular thought logs, we're trying to get them to counter the automatic negative thought, which really just brings out, "You're wrong, why are you having this thought, stop having this thought." So what this does is it validates you're okay for having this thought. There's some evidence that proves that this thought is a normal thought to have in this situation. So go ahead and think of the evidence that we've talked about. I know you don't have the video, so I'll throw some out there. What are some evidence that Scott has that he is a bad son, or that he is unlovable, or et cetera, et cetera? So for example, some of the things that Dad said were, "He's right, I am trying to kill him." Right? So the thought, "I'm unloved," is not too far-fetched if Dad wants to kill you, right? So is there any other evidence that Scott may have that proves that that thought is true? And you can make this part up, right? What? He pays more attention to mini me than to Scott. Yep. Yeah.
His dad was really successful at being evil, and because he's wanting him to fill that position, he's like inadequate.
So dad's really good at being evil, and I want to be a veterinarian and have a petting zoo. I might not be as good at being evil because I've got a little bit of a heart. Yeah.
He's never shown up at any of my events, but now he wants something.
So he's never been there before. He wants something from me. That's a great one. Any other evidence that Scott might have to support that automatic thought? The I am statement. It's pretty good. You guys had a pretty good list. Now we're going to do the opposite. So is there any evidence that supports that that thought isn't 100% true? So this piece is really important in how you word it to your client because you're using 100%, meaning we've already come up with that it's partly true, right? We're validating that that thought is partly true. Is there any evidence that supports that it's not 100% true? That there's some room for error in that thought? So is there any evidence to the contrary, right?
Well, Dad loves you because if he would want to be like you.
Okay, perfect, yep. He hasn't killed him yet. It's just a thought. Perfect. Any other evidence that it's not 100% true? Other people love him. We don't really know a lot about Scott's relationship with his mom, but hopefully she's...
She did show some affection. She would get after Dr. Evil, but there was some
protection. Okay.
There was a favoritism. She protected her son.
Okay. So mom loves me, mom protects me. That's evidence, right? I have a heart, right? So I'm not super evil, so I'm a good person because I want to take care of animals, right? I want to be a veterinarian. I want to have a petting zoo and not an evil one.
Do you have space for four? What if they're like, I can't think of any more? Do you make them like come up with four, or do you leave it?
I do. I usually make them come up with at least two. And if not two, then at least the number that they have for the evidence for it. So I never want that to outweigh it. We will go over some of them today, but if you forget everything I said, on the back, the second half of this is questions to get at more. So I don't want you to use it quite yet because we're going to role play this, so I want you to kind of play with it in your own words, but if you get stuck, you guys can come back to this. So there's some great questions like, well, if I were in your shoes, right, and I was having this thought, and I was your friend, what would you tell me? Oh, well, you're great. You know, we have a great relationship, and I've learned a lot from you. Okay, so let's put that one on there. Okay, so it has a whole list of other questions that you can ask to kind of get at that, but yeah, I would not have it be unequal. So at least equal, if not more. And this is typically, well, I'll get into that in a minute. We'll finish this, and then I'll tell you why I like it. So any other evidence that it's not 100% true? He tries to please him. He's a student, so he's recognizing strengths. He showed up at group therapy, so he's wanting to build, he's wanting to work on this relationship. He might have a different agenda, but he's there, right? So he's engaged in building that relationship with his son. Okay, so this is probably the hardest part out of the whole thing. So the next box is the more balanced thought. So this one you're going to connect with the word and instead of but, right? Because we want to be strength-based. So this is where you take one of the evidence that it's true, one of the evidence that it's not true, and combine them into a more balanced thought. So for example, my dad says he wants to kill me, and he hasn't killed me yet. Right? So that's a lot better than ending the sentence at, my dad wants to kill me. Right? And that's where it ends. So, or let's come up with some other examples. So because I didn't write all yours down. So use some of the examples that you wrote down from each box. And usually I try to get the ones that kind of go together, right? So you'll have ones that kind of pair similarly. So try to match those if you can. Sometimes they don't, and that's no big deal. But see if you can come up with a balanced thought using two of your evidences. A lot of times with my clients, what I'll do is ask them, which one feels more like you? Which one of these feels like something that would go through your head? And they'll identify which one sounds more like their internal dialogue. And we want to choose that one because that one's going to be the one that they're going to most likely use after they leave your office. Does everybody have a balanced thought? Yeah.
My dad never shows up for my events, and he came to therapy.
That's a great example. Yeah, that's a great one. Anybody else come up with a balanced thought?
He hasn't been there for me, but
Try that one more time with and instead of but. That's okay. I do that all the time too.
Has been there for me, and he wants to teach me to be evil.
Mm-hmm. Any other examples of a more balanced thought? How did your guys' reactions feel to hearing the balanced thought versus just the one where it's the very first automatic negative thought? So somebody give me the first automatic negative thought that we had written down. My dad is evil. I'm a bad son. Does that sound different than my dad didn't show up for me and, before, and he's at therapy now? That's a big difference, right? So and which one's more realistic for the situation? The more balanced one.
Why is it that we and instead of but?
What happens internally when I say, you did a wonderful job, but I want to see you here next week?
Yeah, he said he doesn't love me, but he did come here so much.
It's one of those words, there's 3 words that cause automatic internal reaction regardless of what follows those words. Does anybody know what they are? Why? Why'd you do that? Right? That's got some shaming to it, even if it's not meant to. So it just got that automatic, like, I have to get defensive. If somebody asks me why, our defenses automatically go up. So why is one, but is one, and the other one is, I just went blank. You. Right? So that's why we use I statements, right? Because you did this to me, or you did this, or you are going there, is automatically raising defenses. So even though a strength follows the but in this circumstance, we want to always try to use and, because we just want to take away that defensive-ness because we're already dealing with a stressful situation. So our defenses are already up, so if we take away those kind of anxiety-provoking words, then it just helps to facilitate those feelings a little bit easier. That's a great question. And I still catch myself, so I still catch myself saying but. It's just something to be aware of when are we using it, how are we using it, what's the tone of voice that we're using when we use that word. So yeah, you, but, and why. Those can be some tough words. Okay. Any other balanced thoughts that you guys want to share? No? Okay. So the last part, now what I'll do in my therapy sessions with the new behavior response is either put down a coping skill that you've already introduced that's healthy, or this is your chance to introduce a new healthy behavior. So instead of running away, instead of yelling at your dad, what else could you do in this situation, right? And usually they'll have a different response because 99% of the time when I have them re-rate their feelings just by going through this, the feelings are dramatically decreased. So instead of a 10, we're now at like a 2 or 3. So there's a little bit more clarity with problem solving and what to do because we're not at that heightened emotional level. So I've had maybe 1 or 2 times ever that the feeling maybe only dropped a point, and it was a pretty awful situation. So, but usually that's why this is one of my favorite interventions, is because even just going through something that has already happened helps them feel better about a past event, and it helps with the future templating, right? So it helps build the balanced thought for future events, hopefully, which will decrease the emotional liability with it. So that's one of the reasons it's my favorite. So usually you'll get when you re-rate the feelings, they'll be less, and they'll be able to introduce a new behavior response that's not maladaptive. So when I say to Scott, what could you try differently with your dad when you're in this situation, and your dad wants you to be evil, and he wants you to take over the world, and you're feeling really terrified and confused and conflicted, and you're thinking, I am a bad son, what are you going to do now? And usually they're like, well, I could take a break and go for a walk and kind of just let myself breathe, or I can, talk to my mom about it because she protects me, and she'll let me know that dad doesn't really want you to take over the world, he just wants you to follow in his footsteps, or something like that. So they're able to problem solve a little bit more effectively in that situation, and if they can't, that's where you can introduce, why don't you try this, and let's practice this. So then you're templating that coping skill to use if the situation is going to happen again. So most of the time when you have your clients identify a stressful situation, it's not a one-time situation, right? If it was a one-time situation, it probably wouldn't be on their mind as distressful later. So usually it's something that happens over and over again, right? I'm getting bullied at school. My mom's always, I'm always getting in trouble and getting grounded for this. So it's usually situations that are going to happen again in the future. So this way you're future templating. So then you introduce the new coping skill, and then if you have really, really on-target clients who always bring back their homework, have them try the new behavior, keep the log, and re-rate their feelings after they do the new behavior. That's a little bit trickier. That's Dr. McCain's presentation on motivational interviewing with bringing back homework. But even just if we never get there, when we do the thought logs, we typically get a lot more decrease in those negative feelings. So does that make sense? What are first reactions to going through that with me? Like it? Okay.
Yeah, it's a little bit more a clear process of having a client from like point A to point B.
I will tell you the times that I use this the most often in my own practice is when I get stuck and I'm noticing that I'm in that yeah but cycle with clients. This is where when I start to use it the most is when I have the clients that are like yeah but then this happened, and we just get stuck in that cycle of really kind of that cognitive chess game, and we need to pull them out of there and connect them with the core belief, what's really going on, and what are we going to do differently. So I've done this so many times that I have it memorized, and that's one of the nice parts about doing this. That's why I'm going to have you guys role play it to get it into your own words and get it kind of in a more natural setting, because not all the time can you bring out this worksheet and say, let's go through this. Sometimes you need to get out of that resistance with your client, and you don't want to break that by going and getting a worksheet and pulling it out and doing all that. So if you have a more natural way and you kind of know where this is headed and you can map it out, you can pull this up in your natural conversation, and then once everything's done, I'll say, now I want to show you what I did so that you can do this on your own thoughts, right? And then teach the skill. So that's most of the time I don't actually go through the worksheet with my clients on the worksheet. I go through this process verbally with them on the first time, especially if they're already at a high emotional level when they're telling me about the situation. So I'll get the feedback, and then I'll tell them, okay, next time this happens, I want you to try this. I want you to try this worksheet, and I'll introduce it and have them go through it. Now, if I'm introducing it as a skill building, and I'm introducing it and it's not in an emotional interchange in therapy, and I pull out the worksheet, I do the writing. So that's very important, because obviously when you first look at this is a lot of stuff. It's a lot of therapy words. It's very confusing. I don't want the information to get lost with them trying to fill it out on their own. So I go through, tell me what the situation is, tell me what your feeling is, and that helps me a lot more with these kinds of exercises. I think when we have the clients write it down, a lot gets lost. So it takes the pressure off. How many of you have had clients that are like, I don't know how to spell, I don't want to do that, I can't read, and then it increases their anxiety already because they don't want to embarrass themselves or be judged or whatever. So it just alleviates a lot of that. You can go through it and write it out. Any questions about it? No questions? You guys ready to try it? Clap once if you hear me. All right, I got 2 claps. Clap twice. All right. All right, what do you guys think? What were the strengths from it? What did you like about it?
The strengths for what I saw as observing is the smooth sequencing. Will eventually lead to the other. Okay. The trick is to not get diverted.
On your tangents.
It's too easy to go off onto conversations and expand on other things that are associated, as opposed to staying focused on trying to get through this process.
That's a good point. So Dr. McCain was saying that it's a smooth process as long as you kind of stick to the flow. So it can get easy to get off on tangents. I will say with most people, it'll take me about 40 minutes to get through this. So this can take up to a whole session. I know I rushed you guys to kind of go through it, but you're also familiar with all the words. So sometimes it's a little bit easier and it doesn't take as long, but sometimes you do get kind of off on these tangents. So that's a great point. Any other things that you liked about it?
It felt really purposeful about feeling scripted.
Mhm.
Like the direction of the conversation, and it was feel like I was forcing her to answer in a certain way, or just kind of like passive.
Okay, so natural, didn't feel scripted.
Getting more insight, so as a therapist, because a lot of the thoughts maybe were to us were like, that's ridiculous. Like, why would you ever think that? And then when you really feel like, oh my God, this poor person.
Mm-hmm.
I see that now.
Yeah, you see where they get the thoughts. So when I did, the most recent one I did, which I had to laugh because it was, the mom had that experience. I was doing it with the child, and the mom's complaint was this, she's angry for no reason. And so after we finished this whole process, she went, oh, so there is a reason, she's just not communicating it to me, right? So that's, yeah, very different. Hold on, I'm going to have you speak into the mic so everybody can hear you. Well, it's for the camera too, so that way people in the future can.
Yeah, what's really great about this is it can help us understand culturally some of our clients as well, like their thought patterns from different parenting styles of different cultures. I think that really helps.
Mm-hmm. Awesome. Any other strengths? Any other things that you liked about it? Okay, what were the challenges? What didn't you like about it, or what was tough? Where'd you guys get stuck?
For us, it wasn't so much a problem that it was recognizing with the example of anecdotes, which is one of our kids is extremely affective. It's hard to remove somebody who's extremely affective from the feeling part.
Mm-hmm. So it's extremely hard to move from feeling to thoughts. I use this as an assessment a lot too. So I can't tell you how many times I get to what feeling do you have in that situation, and they give me a thought. So I know, oh, I got to backtrack. We got to do feeling identification first, right? So if they're not even able to identify the feeling, I'm not going to be able to complete this. I got to go back to what are your feelings? How do you know their feelings? What comes up versus finishing the form. That's why a lot of times. Mm-hmm. Yep. Yep. And that makes sense because you deal with all the externalizing behavior stuff, right? So typically, and think about yourself, think about kids in your life, or think about your clients. Everybody experiences the triangle, right? So we all have different times where my thought leads to an action or a feeling, or sometimes the action will lead to a thought or feeling. Sometimes there are some personalities and there are some people where we lean towards one or the other, right? So for a group of people, some of the kiddos that you're working with, they're action-oriented, right? So typically, if they're go-to on the triangle, they're going to be action-oriented, and so they act first and then think and feel, right? And then sometimes we have other people who fall under some of the anxiety disorder spectrum that are going to think and ruminate first and then feel and act or not act, right? Some of the depressive disorder stuff, they're not in action, they're in thought and feeling mode. So a lot of times with our certain diagnoses or certain populations, you'll get groupings that are more on one end of the spectrum. So then our job and our goal becomes to connect them with the other side, right? So we know the number one thing with depression is behavior activation, right? So once they start doing stuff, exercising, calling their friends and family, they start to feel better, right? So that's another way you can apply the triangle, is try to figure out where are they usually at, what's their go-to response. So that's a great point. Any other challenges with it? Any other areas where you guys got stuck?
I think for me, the most, and it was like what you guys were doing, it was like I was trying to stay a step ahead and think of what I would say.
Mm-hmm.
The transition to the more balanced thought was difficult,
Mm-hmm.
or tougher. It didn't seem as natural
Okay.
to the other areas.
That's a great point. So Sarah's talking about the transition to now let's come up with a balanced thought. The way I deal with that, because that is a normal place to get stuck, the way I deal with that is I have my intro that I give to my clients about that section. So I'll say, now we're shifting gears. So we've got, the reasons that you feel this way or think this way, and now we've got some reasons that might not be true. And now we're going to combine them and come up with something that feels a little bit more realistic that you can then use in the future. So I'll give them that introduction to that area so they know where I'm going. And then another thing that I'll try that's not on here that's really been helpful for my own practice is I'll have them go back, and I heard some of you guys doing this. I'll review the whole thing with them and say it out loud, especially if I'm writing it down. So the situation is this, you're feeling this, you're thinking this, you're doing this, it's somewhat effective, here's the balanced thought, and then I have them compare and contrast the original thought with the balanced thought. Does that feel different to you? Hearing that, hearing me say this thought versus the balanced thought, and 90% of the time they're like, whoa, that sounds really different, I don't feel as upset. And that's our goal, right? We want to decrease some of that, those high levels of emotion. So just hearing that after they've gone through the whole process, kind of summarizing it and coming back to what the hard work that they've done to get there, especially if it's been a 50-minute session, right? So if I've spent the whole time going through this, identifying the feelings, going off on tangents, coming back, so kind of summarizing it and then comparing and contrasting how they feel, just hearing that difference from somebody else is really helpful as well. Any other challenges?
I got stuck with a patient who nobody else in here ever deals with, and that's the I don't know answer.
Mm-hmm.
So you get to a certain place and you say, I don't know.
Mm-hmm.
So you're trying to figure out how do I get around it, over it, under it, how do I move this person into either this process or along the flow. And that's a challenge really with any types of interventions. That was hard here. We kind of hit a spot and the brakes just went on, and it was tough to move it to the next phase.
And who says I don't know the most often? Teenagers. Not just kids, teenagers, teens, right? I'm fine, I don't know, I don't want to talk about it. So my icebreaker with that, this works about half the time to get through that, is you don't know or you don't want to talk about it. Because then you're identifying there's discomfort and unpleasantness talking about it versus I really don't know. So sometimes they get that I really don't know the answer, and that's a whole different blockage versus I don't want to talk about this, this is uncomfortable and unpleasant. So that's kind of my first initial in on that, and usually I can figure out by their response which way to go based on how they answer that question.
I think another thing is you have to gauge, you have to know your client, you have to gauge, and I think there's a readiness, because CBT is so structured, it can be very directive, and I think we can also kind of lead them, which I don't think is going to be real effective. So I think you have to get to know your client, you have to gauge them, and there's got to be a readiness, I think, like with any therapeutic approach.
Exactly. This wouldn't be that's why I say I start with this as kind of an assessment with the identifying feelings and thoughts, because if I don't know my client well, I probably won't be able to get through the whole thing, because this is a pretty intense skill level just to be able to get through this whole process, especially if they're stuck in that, going over that broken record and going over it again. So that's a great point, and really knowing your client. The other question that I use a lot to get through that I don't know is, well, what would your best friend say, right? Or what would your parents say, or what would your teacher say, or what would I say if I were in your position? So having them kind of step outside of themselves and come up with a different response can sometimes get away from that as well. One of the questions on the back that addresses that, because remember, you guys have little cheat sheets. So on the back, where the directions, there's some questions to help you with that I don't know. So one of my other favorite questions to use that's on here is, has this ever happened before? And what did you do, or what did you think, or what happened after the previous situation? Even if the previous situation was a little bit different, because you might get enough of a twist to get them out of that space where they don't know this situation, but maybe they had a similar one that they can problem solve with.
I got a question.
Yeah.
In regards to the type of client patient would this strategy or intervention be most appropriate for?
I've used it with just about everybody. So I will say that I'm not a CBT therapist, but I use CBT, right? I would say that it works well with just about everybody. I think typically with the little kids, I'll use it with the parents. So that's one way that it'll be a little bit different. If, like the parent I was talking about earlier who responded with, well, she's angry for no reason, definitely use with the families that are experiencing that, where there's lack of communication or not effective communication. So if there's chances to build empathy, those sorts of things, if clients are experiencing difficulties with that, I would use it with people who go through communication difficulties with their family. But I really haven't had, I'm trying to think, the only time that it's been really problematic for a client to use this is when the situation has validity. And so what I mean by that is if there really is no evidence that that thought isn't true, you're going to get stuck, right? So when and they talk about this a lot in EMDR therapy, if the core belief is valid, or if there's a lot of validity to the core belief, then you're really going to get stuck. So when you're starting with the situation and the core belief goes with the situation, and I'll rack my brain and see if I can come up with a legitimate example, but that's the only time you're really going to get stuck, where it's not going to be useful, because you won't be able to come up with any evidence that it's not true.
I think like what you're saying is like if they're, I'm thinking like with children or even with adults, when they're in a situation that their behavior is actually maybe coming to a point of protectiveness, and rightfully so being protective. So they might have this protective, shutting down or whatever it is from the other person, say their parent, because there actually is harm that is actually being done. So it can be dangerous if you're telling the kid, well, you need to open up, or you need, and without talking, without changing the structure. I think that would be the times when you, like you're saying, if it's not true or what's happening, if there's any abuse going on, to really make sure, because if you're asking your child to do that, you're putting them to a lot of harm. And so just kind of being, like you're saying, just being careful of like if these core beliefs are matching and it is true, this kid's responding based on truth, and it's probably at this point the best response he has to protect himself, and not to challenge, change your ways until the structure is changed, so you don't have to feel or do this to protect yourself.
Yeah, an example, kind of a harsh example that I can think of would be if there's a child that's been removed from home and they're in foster care and their parent really, and they don't have, and this is rare, I don't see this a whole lot, but I have seen it, where there is no positive attachment memory, right? So if our brain can go to, okay, in this situation, I have this negative memory, but I've also have other positive memories to attach to this negative memory, right? So that's what keeps us as friends. If I have 10 memories that are positive with one friend and they mess up, I've got 10 other memories to go back to, and that helps with forgiveness and empathy and, building on that relationship. If a child doesn't have, or an adult doesn't have any positive memories mapped to go to, you could get really stuck, right? Because then there's no validity. There's validity to the negative thought versus being able to come up with that balance. So that's a really good question. Like I said, that's pretty rare. So and that's again comes back to knowing your client and as soon as you hear that situation, and if you're like, well, I could see, that's going to be difficult to find a positive attachment to, then I wouldn't continue to go through it, or I would go through it a little bit differently. It's a great question. Any other challenges with it? What did you guys that were observing, what did you get out of the observations? What did you guys notice? What were people doing well? How did people reword things that made it flow more naturally or feel more conversational versus scripted? Were there ways that anybody asked?
I think it's a situation where it's about repetition. It's about really going through this enough times that you know the core principles. When you don't know that and you're doing it for the first time or the second time or what have you can get stuck and you can get caught up in what Dr. McKay was saying into the conversation and go off on other ways where you have to stay. It's important to stay structured and go through the core principles. So I think it's about the repetition and knowing the actual substance of what you're doing.
One of the ways that I'll handle that is, that's really important, and I want to get back to that, but let's finish this first and then we'll come back, because that's really important. So validating that, I hear that, it's important, and now let's refocus. So that's one way that you can kind of pull it back. So that's a great question. Anything else that you guys have noticed from observation? Okay, we about time? Okay. Any remaining questions? Because we're about time.
That's all I kind of agree. I think with anything that's new, it's going to be hard. If you're having a tough time with it, and that's what I noticed, and even me actually going through it as a therapist, it's going to be hard, to get it across to the client. It's going to be hard for the client to understand the answer. So, I think about, relating this to the first time I learned how to do a CFT. It's the same kind of thing.
Yeah.
I had a hard time explaining, what goals were and objectives and the need statement, and of course the client had a hard time getting it out.
Yeah.
A hard time explaining.
Yep.
The more I did it, the repetition, I was able to, be more relaxed and explain it a lot more easier.
And then they pick up on that ease. So practice with each other. I practice this in supervision all the time. I practice this with family members. So it's you can there's ways that you can get comfortable with it. That will definitely help with that. Yeah, I think you guys had some great questions. Thanks for engaging in that with me, and hopefully you find it useful. And if you have other questions, I'll hang out for a minute since we're about time's up. So, all right. Thanks, you guys. Yeah.